People start smoking for different reasons. Some think it looks cool, but it's totally not. We are vulnerable to infections and injury from the external environment because of the constant exposure to chemicals. Air pollution kills an estimated 7 million people worldwide every year.
Hundreds of people are dying in the Philippines every year.
Posible itong magdulot ng asthma, lung cancer at heart disease dahil madali itong makapasok sa respiratory tract ng isang tao.
As a result of increased mortality from respiratory infections, the respiratory system can have many problems, some fatal and some not so harmful.
Hi, I'm Mikaela Mai, 20 years old.
I am Margarette Llena and I'm 17 years old.
I am Aleck Ferry, 16 years old.
A lung cancer survivor. I was diagnosed when I was 15 years old.
I was diagnosed with pneumonia.
To experience asthma. I was diagnosed 3 months ago.
The first symptom that I have observed is cough. Along with this, I also had difficulty breathing. After a day, I have had a high fever and I don't have any appetite. Also, I feel nauseous sometimes and I would just vomit.
First, I had cough. I thought it was just a normal cough. But it lasts until 3 weeks. And it gets worse until I start coughing blood. So that's why I decided to go to the hospital.
The symptoms and signs that I experienced to a severe asthma attack include wheezing, coughing, and chest tightness, becoming severe and constant. Second is being too breathless to eat, speak, or sleep, breathing faster. Fast heartbeat, drowsiness, confusion, exhaustion, or dizziness, blue lips or fingers, and fainting.
So, as for my case, my doctor said that my pneumonia was caused by a bacterial infection. So, this bacterial infection can be acquired naturally through the air that we breathe, or it can be acquired after having a viral cold or influenza.
I think the cause of my lung cancer was I exposed too much to secondhand smoke, since most of my family do smoke.
Many things can cause these symptoms, but they are more likely to be asthma if they first, it is happen often and keep coming back. Second, are worse at night and early in the morning. Lastly, it seemed to happen in response to an asthma trigger like exercise or an allergy.
After 3 days of having the symptoms, I decided to go see a doctor. So the doctor performed a physical examination wherein he used a stethoscope to listen to my lungs. He suspected that I have pneumonia, but in order to confirm if it is indeed pneumonia, he ordered me to get blood tests. So when the laboratory results came, he said that I am indeed infected with that disease.
Diagnosis was January 2016 when I decided to go to the hospital. The doctor did a lung biopsy where he inserted a thin lighted tube through the mouth and down to the air passages to the tumor and removes a tiny tissue sample.
Asthma can usually be diagnosed from your symptoms and some simple tests. A general patrioner will probably be able to diagnose it, but they may refer you to a specialist if they were not sure. Phenotest. It is the one who helped me to diagnose my asthma. You just breathe into a machine that measures the level of nitric oxide in your breath, which is a sign of inflammation in your lungs. But there is more tests that can help you to diagnose an asthma. First is spirometry. You just blow into a machine that measures how fast you can breathe out and how much air you can hold in your lungs. And the other one is peak flow test. You just blow into a handheld device that measures how fast you can breathe out, and this may be done several times over a few weeks to see if it changes over time. After you are diagnosed with asthma, you may also have allergy tests to see if your symptoms might be triggered by an allergy.
Since it was just a low-risk pneumonia, I didn't have to get hospitalized. The doctor prescribed me medicines for my fever and for cough, such as bronchodilator. And he told me to get a lot of rest and to drink plenty of fluids.
Since my lung cancer is not that severe, the doctor decided to treat me with chemotherapy, where you use special medicines to shrink or kill the cancer.
I usually do the home remedies for an asthma attack. Example is caffeinated tea or coffee. The caffeine in black or green tea and coffee is believed to help treat asthma. Eucalyptus essential oil, lavender essential oil, and breathing exercises.
"30 million people around the world have been infected with COVID-19.
A 50% rise in the number of people who've died of COVID-19. Lagpas 90,000 o 91,754 na ang mga aktibong kaso ng COVID-19 sa bansa.
Shall be suspended beginning March 15, 2020 and to end on April 14, 2020.
I am Mance Carmona, 18 years old. I was diagnosed with COVID-19 disease 3 months ago. The virus that causes COVID-19 spreads easily among people, and more continues to be discovered over time about how it spreads. We diagnosed in COVID-19 when one of my family members goes to the grocery store to buy our groceries. And she exposed in COVID-19 when she went home that night. According to her, she has a high fever. Same thing to my brother and to me. But luckily, my parents nor the others didn't have this kind of unusual feeling. And unfortunately, when we came up to test ourselves, we became positive, all of us. Theirs are asymptomatic, but to me is a severe one. I am rattled on my own thoughts, and we have decided to have a self-isolation for our own sake. We ate foods that more on vitamin C, and we followed safety protocols, and after 2 weeks, the result of swab test is finally negative.
If someone said the words, healthy living to you right now, what would you think of? Most of us would probably immediately think about our diets and how they affect our weight, and think about how exercising keeps our waistline slim and our hearts strong and healthy. But how long would you think about tips for a healthy respiratory system? As we get older, our lungs start to feel the tear of everyday life. But it takes more than just refraining from smoking to take care of our lungs. We should be breathing, eating, and exercising in a way that keeps our lungs healthy.